going to start the second portion of the hand lift, hand rejuvenation procedure. The treatment that we're going to, or the filler that we're going to use is Radiesse. It's a milky, thick, considered to be one of the top, wrinkle fillers that we use, and it's going to be placed in the back of her hands. One thing this patient just asked me is, how do I know, if I'm going to hit a vein? And luckily, that's one reason we do the hand rejuvenation procedure, is that in the back of the hands, the veins become so prominent that it's a really safe procedure because we can, avoid the veins. And another thing that I've mentioned to the patient is actually going to be placed in little blebs. It's not actually going to be placed in linear, more like it would be done on the face. And then we're actually going to massage the Radiesse in after we get it placed in the hands. So I'm going to pinch up just a little bit of her dermis here. I'm going to make sure I'm not in a vein. You can see it's going to make a little knot here, which when we get it all in, we're actually going to come back and it massages right in. So you can see it kind of looks like a lump so far. And I just take my hands and we just massage it right down into the groove.
So Dr. DeGraaff, how critical is the placement of the shot with regard to the results that the patient would get off of a procedure?
The main thing is to not get in a vein, and then to get, believe it or not, it's pretty superficial. In the back of the hands, there's just not a lot of tissue here. So initially we can pull up the skin just to make sure we're not, that we're in the skin tissues, but not down in the tendons or anything like, where we don't want to be. So depth, and then just making sure we're not in a vein.
How long does a treatment like this typically last?
Oh, that's a good question. It lasts about a year. The brown spots may need to be touched up periodically.